Hello everybody, I'm excited to be back in front of you. I am Dr. Tim Dunne with Advocate Integrative Medicine, and my topic for today is the building blocks of health. We just came out of COVID, we just came out of the new year, and a lot of people still don't have their health about themselves. A lot of people are still struggling to find their health. So we have to first look at what is health, how to get it, how to keep it. That's important to us. So the chart that I have next to me, it's based on your needs of your body. And here's the example that I tell all of our patients, folks. How long can you go without food? Roughly a month. How long can you go without water? 3 to 5 days. So which is more important to your body? It's water, right? So your body has a hierarchy. It has a needs. There's certain needs are more important and you need more often, like oxygen. And there's other needs that are much less important, like food. So that's how we put together our system of taking care of people. It's based on God's hierarchy on how to address your needs. So let's get started, folks. Again, building blocks of health is based on your importance. The number one is your central nervous system. Folks, there are 11 systems in your body. 11. Life starts at conception, and the first system to develop is your central nervous system, which is your brain and your spine. The reason it's the number one is because your brain controls and regulates every other cell in your body. Therefore, when you look at importance, it's number one. But also, I like to give you examples. And the example of central nervous system is this. If you were involved in an accident, God forbid, and you're paralyzed. Paralyzation means that you've lost full neurological function from there down, if we're talking about a spinal injury. Full neurological loss from the site of the injury down the rest of your body. That's paralysis. That's 100% loss of nerve flow. What is 50% loss of nerve flow? What does that look like, folks? And I would say, and I would debate with you, that it is loss of function, which is disease. More specific, chronic disease. So that's why your central nervous system is number one. Because out of the 11 systems, it's the priority. It's the number one. It controls and regulates the other 10. So how do we take care of our central nervous system? Priority number one is chiropractic, and that's why I became a chiropractor, folks. Because I recognized in my early anatomy classes the priority of the body. What's number two? Number two is going to be oxygen, O2. You have to breathe, and you have to breathe often, and you have to breathe all the time, right? I'm thinking that it seems like people that dive deep in the water can go down 10, 12 minutes, something like that, 20 minutes, I'm not sure. But we're talking minutes. Is all air the same? No, it's not, because if you're smoking, you're getting garbage and pollutants and toxins being put into your body. If you're around asbestos, if you're around manufacturing facilities, you're getting garbage and toxins being put into your body. So that's why we want to take out smoking. We want to get you outside. Stay away from the garbage, folks, and get outside. Best, get outside in the woods where the trees are, where they're producing all this oxygen, especially now in the springtime. Get out. Get outside, quit the smoking. Because it's only minutes. Number three is going to be your sleep. You can go 48, 72 hours without sleep. Is that optimal? No. Because here, folks, what are we talking about? We're talking about building a framework that is optimizing your health. We're talking about giving you a framework that you can plug into your schedule, that you can plug into your phones with alerts and keep you on track to give you the body that you want. And folks, what is your body? Your body is two things. Your body is your history book of your life from conception, and your body is your vehicle to get through life. And as long as you're living, you're continuing to write chapters. So let's write some good chapters. Okay, let's move forward in a positive way. Number 4 is water. You can go 3 to 5 days without water, but water and oxygen are the 1-2 punch that your body has got to have. Those are the things you have to give it. Is all water the same? No. Water must be filtered. It must be cleaned. Reverse osmosis is best. And they even have home systems. Contact my office and we'll put you in touch with someone for home systems that will clean your water so that whether you're showering in the water, whether you're cooking in the water, whatever you are doing, you're getting clean filtered water. How much is best? Half of your body weight in ounces per day. I weigh 250 pounds. I'm going to need 125 ounces a day, and that's about a gallon of water. Know what you need, and then give your body what it needs. Bottled water is not the same as RO water, folks. Filtered, clean water, that's where it's at. Now we're down to number 5. So before I get into number 5, let's go back and slightly review. If it's January 1st and you want to get healthy, number 5 is food. And isn't this what we always talk about? It's January 1st. I want to get healthy. I have a New Year's resolution. You don't need a resolution, folks. You need a revolution. And a revolution involves totally changing everything about what you're doing. And that's the only way you're going to get different results. So when you're looking at being January 1st, this hierarchy is the way you need to approach it. Otherwise, you're putting the cart before the horse and you're setting yourself up for failure, and that is not going to benefit you. January 1st, start the right way. Let's move on to food. High in vegetables, organic foods. You need good fats. Back in the late 60s, they tried to hang the whole diet craze on fats. It's not fats, folks. Your bodies need fats. But it needs good fats, not bad fats. So we can help you with that. You need proteins. You need good, clean, organic proteins. Know where your beef and your chicken and fish are coming from. Your different meats. Know where they're coming from. Make sure they're clean, non-steroidal, non-hormonal. Make sure they're clean. And then we can get onto some carbohydrates. But I've never seen anybody get sick and diseased because they ate too much broccoli. Make sense? And if it's 10 o'clock at night and you're like, I'm hungry, have some spinach, have some broccoli. You can put oils and balsamics on them and make them taste any way you want them to. So what we're really talking about, folks, we're not talking about taking something from you. We're talking about substituting things for you. That's the big difference. Stay away, big one, stay away from processed food and sugars. We understand, folks, that cancer is fed by sugars, by processed sugars. We know that because of the PET scan. The PET scan is confirmation of this. If you have cancer, stay away from the damn sugars. Okay? If someone hasn't told you that before, please stay away from the sugars. Stop feeding your cancer, right? Stop feeding it. Get away from the processed foods, okay? Real quickly, going back to water. You get up in the morning, 20 ounces of water. Before you eat, 10, 12 ounces of water. When you do it that way, your stomach fills up. It gives your body what it needs with the water, and you're not eating as much food. Fair enough? Now I'm down to number 6. I'm down to 6, folks, exercise. And this is what everybody wants to do January 1st. Folks, you cannot exercise away a bad diet. Do you hear me? You cannot exercise away a bad diet. It's the quote from my wife, Dr. Cindy. Exercise 2 to 3 times a week. Optimal, right? More, you can do better. HIIT training, high intensity interval training, twice a week, 20 minutes. Turn on, turn off, maximize efforts, twice a week. That is for oxygen uptake and hormone regulation. Folks, that's the purpose of exercise. Oxygen uptake, hormone regulation. You achieve that through HIIT training. I promote heavily lifting weights because when you're stronger, life is easier. When you're lifting weights, your body mass increases. You can eat more food. I, like you, like to eat more food. I enjoy my dinners with my wife and my kids. So therefore, if I can lift weights, if I can be strong, life is easier, I can eat more foods. Tell me what's bad about that. You fill out your clothes better, you're more shapely, your shoulders are more shapely, your arms are more shapely, your legs. How is that bad? Exactly. HIIT training for oxygen and hormone regulation and to burn off the excess. Weight training to re-sculpt and to build the physique that you're proud of. That's what it's for. Number 7, meditate. Meditate. The reason that's so important, folks, is it gets your mindset right. It gets your mindset in the right place. Get up in the morning, first thing in the morning, get your coffee, get settled, open up your Bible. Open up something to meditate on. Open up the Word. Get into the Word every day. And let that set your track for the rest of the day. Let that set your path for the rest of the day. Folks, you need to know where you're going throughout the rest of the day in order to get where you intend to be. You can't go just by chance. You can't wing it and have the success that you want. Meditation. And lastly, folks, plan your work, work your plan. Put it on paper. Write it down. On Sundays, afternoons, between 2 and 4, sit down and analyze what you did the prior week. Go through each one of these. Analyze how you did and how you didn't do. And then come up with a plan to make you better the next week. Plan your work, work your plan. Our office is constantly taking new patients. Call today, get on the schedule. Start the process of getting your life back. Check out our next video that we're about to do. It's on calendar. It's on planning your work and working your plan so that you achieve those things that you want to achieve. It doesn't happen by chance, folks. It happens by planning and it happens by execution and work. You deserve it. You're great. People love you. Now go get it. Have a great day. Call us now.